Today we are going to start with the speaking. This will be second class of the speaking, and here we'll be discussing with you regarding the linguistic criteria. So first of all, as you can see that yesterday we have discussed about the like clinical skills, clinical communication criteria, and today we will be discussing about the you can say your linguistic skills, right? So I'm going to start the class just a minute. I'm going to start a class now with the linguistic. The first skill in the linguistic is the fluency. So, as we started the class yesterday, I have not discussed, I think, that this is the first thing that you must have if you are not strong in fluency. Let's say if you believe that I'm not fluent. So, first thing that you have to work on is the fluency. Like you have to work on your fluency. So, you should have ability to speak at length, and what we can say is the natural flow of speech, the way you speak your native language, right? Number second thing is try not to have the let's say ahs and ums, a lot of pauses, unnatural pauses should not be there, right? So these are two things that we have to see in the fluency part, followed by the intelligibility. Now in intelligibility part, you can see there the first and foremost thing is your pronunciation. Like I would like to discuss this thing. If you would be able to pronounce certain thing appropriately as per the standard, you can say pronunciation, and it's totally understandable what you are saying, you would not pronounce certain thing in this way that it would not be like comprehensible. First and foremost thing that it should be understandable. Number one, it must be. Second thing, you should have the natural intonation. So what is intonation? Intonation mean your tone management. You should have a skill to speak in this way that there should be highs and lows in your tone. It should not be monotonous. And then the word stress, it should be appropriate according to the rules of the grammar. For example, we used to pronounce detail because of vowel, mood, double O D, because of the vowel. We put stress over here. Comfortable rather than comfortable. So these are some of the example. Let's say vegetables rather than vegetables that I have mentioned, so that we can understand. Right? So we do have correct word stress, and secondly, we must learn that stress management at the level of words. For example, if you are asking the question from the patient, you can ask this question. I believe that you have pain in the right shoulder, right? So I'll put stress on this part with high tone, right? I believe that you have pain in the right shoulder. Okay, so we can see that I'm gonna put stress on this part with high tone, right? Anyhow, so this is your word stress that's come under the criteria of intelligibility. Then we can say there is a criteria we used to have is the appropriateness. As the name indicate, we must have the appropriate tone and language as per the demand of the card. whether to use the card with open question, tagging question, whether to build the repo or not. Okay, what kind of tone you should use in which scenario, how would you start, what would be the formality you would follow. This all come under the criteria of appropriateness, and we should not use any medical term, right? So medical terms should not be used. So this is the appropriateness. The last part in the language component is the grammar. Now, as the grammar part, first is the range. You should show the range of grammar. And second thing is the accuracy. Basically, it's not only the range but accuracy at the same time. Then the cohesive devices you have to use. So these are few example that we have discussed with you, or the few criteria part that we have discussed with you that you must have in your speaking part. Okay, is it clear to you? Anyhow, so this was the part of the, as we are practicing now, it's about the workplace health check. It's not a conventional card that we used to practice in our daily setting. It will be little different. Anyhow, we'll see now. So as we discussed yesterday, that we have the work health check, that is a setting. This is the history. We are conducting 15-minute health assessment at factory, and we have a patient who's 50-year-old. He's reluctant. So what we can learn from this line, that the nature of patient is reluctant. So get yourself ready accordingly. So your consultation should be designed in such a way that you should be able to handle the reluctant patient. So reluctancy, before, even if I have not read the card, I must have some question in my mind, like the reason, like why he will be reluctant. But it should not be a blunt question. It should be polite. It should be a quick response that has to be generated by you while preparing. By reading such line, it's something that you can understand from the line, the patient nature is reluctant, and it's been given. The reason is being given. She is concerned about the privacy. Okay, number one. Number second thing is, he is also concerned about the risk of diabetes. So, first of all, when we start the card, like for example, when you come to the point that we are conducting this assessment, you need to explore the patient concern. If he is willing to if he's willing to participate in the this health assessment, or if there is any concern the patient want to share, the patient might like share information in parts. Let's say the first part will be, he is concerned about the privacy. So even if you have assured the first part, and if the patient had not given you the second part, we can go on and ask, is there any other thing that you want to ask? The patient might give you the second reason. So whatever the reason will be, you have to assure. Let's say these are confidential, and you will have the feedback right away. Anyhow, you can see the second answer is not there, but still you have to assure. Then you have to explain the patient what are the benefits. This will be related to the education part. You can use it. There are two parts. The first one was related to profession, and second one was related to individual. So we can use the cohesive devices, like firstly, secondly. And with reference to this patient past history of diabetes, you have to consult the patient for the doctor review, right? So anyone who would like to do this card right now with me, or if you have any questions before you can participate, uh, we can see that how can you do it. You can start this card in this approach. Hello, my name is Dr. Blanca. I'm one of the doctor in this I'm one of the doctor on the behalf of your employer. We are conducting this health assessment. It won't take much time. We'll just need 15 minutes of yours. So before we can proceed further, I would like to ask you if you are having any concern regarding this health assessment or any reservation. please feel free to ask me. So in this approach, when would you start the card, you would have given patient to an opportunity that he can share his concern, or another way
जी
you
सर,
have taken the consent of the patient indirectly by asking if there
जी
is any
सर,
concern or if there is any reservation the patient is having for this health assessment, right? The patient will tell you,
यस
I
सर,
am concerned about the privacy. Right away, you have to assure. Let me show you that as per the standard protocols of our health practice, your information will be quite confidential. It will not be, like open for anyone, or even your employer would be able to access this thing just after your consent. And the more important thing will be that according to for you actually, that you will get the feedback right away after having this health assessment, right? Secondly,
जी सर,
using the cohesive devices by telling the patient like there are broad spectrum, like or the broad range of benefits associated with the health assessment, which ranges from the personal as well as professional benefits. So to begin with, in regard to the professional benefit, it would improve the yield or the productivity. And secondly, the workplace injuries in case of if any, it would also be like decrease, and like the work will be more optimized. Now let's move on toward the personal benefit. You will get to know about your health right away, and the last part you can move on, as you have mentioned that your brother was diagnosed with diabetes. In this regard, it would be more appropriate if you can take appointment from the local doctor. This card, you can see that the patient is here who has been experiencing the pain and swelling, let's say in the right shoulder. And as I mentioned again that he usually plays, not the regular player. I mentioned earlier that I
Yeah.
free play cricket in my free time mostly over the weekend. So,
Okay.
and I also mentioned that I had this pain after a match of cricket, like a day after. You asked me those questions again. It means that you are not listening actively as per the examiner point of view, because
Okay.
two things I mentioned, that I play not on the regular basis, and second
Yes.
thing was that I had this pain night after the match of my cricket after a day. Let's say, sorry. There was some
Okay.
question that you can ask about the patient. For example, what he plays mostly, the bowling or let's say batting, for example. Just to There were a few questions that was positive. You asked about the patient if he had experienced this pain while playing the game, like about the injury, and similarly, you explain this condition to the patient, though you have asked the patient what he know about the bursitis, but it would be better actually if you can explain in the layman language and you can just draw it for you for the patient. The rest was fine.
Sir, how we
Okay,
will
let
say
me
Versailles in layman?
yeah,
Okay, sir.
let me draw this thing for you. Like say there is a cushion between the bone, two of your bones in the, you can say, right shoulder. When you use this thing excessively, so there would be pressure on that part, and that pressure can cause like this problem that we said in the manual as bursitis. Okay, so for that reason
Okay,
you
sir.
are having the swelling in the shoulder. Okay, so
Okay, sir.
yeah, so let's assure you that it can be settled by some methods I'd like to educate you. Then you can see that like you have to see patient have not informed you this point. You have to go it passively. Then it's very important for you not to play the cricket at least to the time then the patient will the swelling will not be settled, and then we can move on toward the management plan and discuss these things, right? But there is some problem, I believe, in the understanding of the card, because you were trying to consult the patient that you are having the symptom. Patient is already being diagnosed. He's concerned about the disclosure of the disease to the children. So that was miss, and I think you were not able to understand. It would be better actually if we have to focus on the patient children, because let's say after you can start this card in this way. Hello, my name is Dr. Blah and Blah. I'm one of the doctor in this medical practice or suburban clinic. So, Mr. Mark, I just have seen your file, and I can understand that you had recently been diagnosed with condition called hashimoto thyroiditis. So, in this regard, can you tell me what is your concern regarding the disease? The patient will ask you about the medical record confidentiality and then disclosure. So you have to ask the patient, first of all, let me assure you that your records are private, like we are not going to share with anyone. Secondly, it is important for you to disclose this thing as it's not the life threatening. However, it cannot be prevented. It can run from person like in families. So disclosure is not urgent, but it's important. Like that, you have discussed. Secondly, about the second point, the patient mentioned that it's something can affect their life choices. Then you have to explain this is the reason that basically it would not affect the quality of their life. However, it will help them to delay the onset of the disease by having the lifestyle. Okay, after being educated, it can help the patient to manage the prognosis, to manage the disease if they would have in their life. Anyhow, so afterward, regarding the insurance, you can tell the patient, well, I don't have much knowledge about insurance thing. All I know that there are a lot of benefit associated with the disclosure, and then you can take the consent if you want. For your better understanding, I can refer you to the genetic counselor. Then I ask you the question that I don't understand that why a genetic counselor is needed. So you did not answer me this question and just finish the card. So try to address all of the patient concern with normal greeting. After that, you can ask the patient, like, how can I help you? In simple start, or I've seen in the file, I came to know that you have blah blah thing. Okay. Like after that, you ask the patient, what is your understanding about MPOA? Okay.
Okay.
Yeah. What is your understanding about the MPOA? What do you know about the medical power of attorney? Then you have to explain the patient what is the medical power of attorney is, right?
Okay.
Yeah.
Yes.
So afterward, you can see there, you have to see, explain it, and then ask the patient, do you have any concern that you want to share with me? After exploring the patient concern, you need to move on and ask explain the patient that it's not mandatory for you to appoint someone, and you can appoint anyone apart from your attorney, right? And secondly, this point specifically, you have handled it appropriately. It has to be done, let's say, one need to be in a good mental state of health before he can appoint someone. As other way around, it will not be legal practice. It will not be considered as a legal thing. So rest assure you, it will not be implemented if you are not in a mental state of health. That is followed by the last point. You have to tell the patient that it's not the job description of medical power of attorney to arrange or refuse the palliative care. And this point was not properly addressed. You can see the patient, tell the patient, like, you have to write down a will, and according to your will, we can prepare advanced care plan that will be followed through the course of your illness. It was fine. I appreciate that.
Thank you.
But you can see the start of the card will be little different because you're seeing the patient for the
Yes, sir.
second time. So accordingly, we'll start.
Yes,
Hello,
sir.
my name is Dr. Hassan. Mr. Mark, how you have been? I believe that the medicine we had prescribed you for Parkinson, you have been taking, and have you noticed any improvement in the symptom? Okay. So
Yes, sir.
then you can ask the patient to take this medicine and also what is his understanding about a disease and try to explain in the layman language. What I mean by
Okay,
the
sir.
layman language that you can tell the patient there's a chemical in the body. Its function is to, is to regulate your some of the daily functions, which include your walking or movement of the hands. Okay, so when that chemical
Yes, sir.
stop working, it can have some symptom as you are having muscle spasm, and you cannot swing your arm or foot properly. Fortunately, there's no tremors at the moment. So these symptoms are just because that your brain has not been producing that chemical. So we need to produce that chemical synthetically now. For that reason, we are going to give you medicine name as L-Dopa. That will produce that
Okay, sir.
chemical, yeah. Then you can tell the patient the physiotherapy, massage, and acupuncture, they can just help you to improve the prognosis of the disease. But that cannot cure the problem, as you can see that your brain has not been producing the chemicals. For that reason, it's important for to us to have this medicine, right? Rest was fine. You have done this thing. Try to have signposter changes between the tasks, which would be more better. Actually. Differently, we have to start with the training question by introducing yourself, and then you can ask the patient. If I'm not wrong, today you are here to collect your blood test report. So unfortunately, we have the same reading as we had the last time, that is 7.6 millimole. So what is your understanding about? Although you have asked about the patient expectation, but you can ask what is your understanding if you are having high blood sugar level. Then you have to tell the patient about the diabetes mellitus, followed by tell the patient what do you know about diabetes, because that point was missing. Patient do know that it's the sugar diabetes, but you did not ask this thing. You have to ask the patient, and patient will tell you that it's your sugar diabetes. So again, you have to ask the patient, what do you know about sugar diabetes? The patient will tell you that it's something related to eating sugar. You have to show that point out. Regarding the point when the patient give you a challenge that just on 2 occasion, then you have to say as the gold standard that we have been following as per the guideline of WHO. It's already established fact, followed by the early treatment plan. In the early treatment, you can use the cohesive devices such as firstly, secondly, thirdly, and so on. Okay, and you can see that patient was reluctant, and you have not clarified this point. You can tell the patient, let me draw these values for you. If you can see that your values are just above the threshold value of the standard has been set by the World Health Organization, it do mean that from how many days, months, or years your vital body organs have been receiving excessive amount of sugar, which is potentially damaging to the vital organs, right? So for that reason, it's important for us to go for the at least observation to check your blood sugar on a daily basis, to have an eye on the blood pressure and cholesterol, so that we cannot avoid any like future complication related to the blockage of blood vessels, heart, or brain, right? And then we can discuss about the lifestyle changes and so on.